Your Houston Morning News with Matt Patrick continues.
KTRH News time is 5:47. Thanks so much for joining us this morning. Dr. Donald Palmisano joins us, former head of the American Medical Association. Dr. Palmisano, we certainly appreciate your time this morning. Are you pleased about the fact that the House struck down the IPAB, the Independent Payment Advisory Board?
Yes, thanks for having me on your program. I am pleased, and I hope the Senate will do the same, although it doesn't look like they will. But this entire law, the Patient Protection and Affordable Care Act, I think it's misnamed. It doesn't protect patients, and it's not affordable. I think this law is a disaster, and the more we can remove parts of it while the court is deciding whether they get rid of the whole thing. And as you know, the oral arguments will take place next week, and we'll probably have a decision by the end of June of this year.
Dr. Palmisano, now correct me if I'm wrong, but wasn't the American Medical Association early on board with Obamacare? I mean, I think I remember you guys were supporting it, at least early on.
Yes, the American Medical Association did give support to that. I spoke out in opposition to that. I don't represent the AMA, but as a former president of the AMA, 2003, 2004 was my time as president. Mm-hmm. I sit in the House of Delegates, and I have microphone privileges, and I spoke out against it, and I also wrote about it. I am pleased that the American Medical Association, through the House of Delegates, they voted to oppose the Independent Payment Advisory Board, and they're also in favor of medical liability reform. So those were the two items that were in the bill that passed yesterday.
Dr. Palmisano, the Independent Payment Advisory Board, I was just talking to a Texas congressman earlier, and he suggested that was what had been referred to as the death panels. Was that too strong of a term, or did the IPAB have or will have way too much power?
Well, I don't like to put terms on there that inflame people. The fact is they have unprecedented power. Basically, they have been given the power to make decisions on cutting payments that will be needed to treat Medicare patients. And as a result of that, it ends up, you can say it rations care, because you can say no money, no mission. So right now they're paying physicians less than the cost of delivering the care, and that's why it's hard to find a physician if you're a Medicare patient. And also if you're a Medicaid patient, which this entire law has put millions more on Medicaid, a failed program, then you see that this whole thing is just going to collapse. They have so many components of this law. They have another particular part of the law, but what we're concerned about is it will end up as in Great Britain, in England, where they end up with a quality-adjusted life year. So they decide they find out how much the procedure is going to cost, and then they decide your age and how many, quote, quality-adjusted life years you have left. You divide those two numbers, and if it comes out over a certain amount, you don't get the treatment.
Doctor, if you hang on just one second, I want to ask you a little bit about what this is going to look like. I'm going to have you get your crystal ball out here in just a second. Joining me, Dr. Donald Palmisano. He's a former head of the American Medical Association, currently spokesperson for the Coalition to Protect Patients' Rights. Let's talk about the patients, Dr. Palmisano. If this thing gets through, Obamacare, fewer people will actually be covered by insurance. Am I right in saying that?
Well, if what gets through, now you're talking about the Independent Payment Advisory Board, or are you talking about the Patient Protection and Affordable Care Act?
Well, I'm talking about the Affordable Care Act, Obamacare.
Okay, the Affordable Care Act, well, the Supreme Court will have the hearings on it. They'll have 3 days of hearings, a tremendous amount of time spent to this. I wish they would put it on TV so we could all watch it. And they'll make a decision late June. And when that happens, I predict that it'll be declared unconstitutional. Certainly the individual mandate, which is, liberty is the absence of coercion. And this violates, in my opinion, the Commerce Clause. And there's no way it's going to pass the Commerce Clause and Necessary and Proper Clause. To be the first time that America regulated inactivity. They have some cases of yesteryear that they'll try to use to make this constitutional, but I don't think it will. I think it'll be a 5-4 vote.
And Doctor, I agree with you, but I'm saying that there will be fewer people covered. Although this is supposed to cover more people, that was the whole idea to begin with. Actually, fewer people are going to be covered.
You're absolutely right. There will be fewer people covered, and even those that do have the coverage, the expansion of Medicaid, it's like giving you an insurance card that's no good. In other words, you go to a doctor, but nobody wants to take the cost.
Right.
What good is it? So it's a sham. What they ought to do is they ought to put everybody in Congress on Medicaid. Everybody who's elected to Congress ought to go on Medicaid. You would fix that system within weeks. It would be fixed.
I like that idea,
yeah,
Doctor.
Alternatively, I've said that for years now. Alternatively, what you would do is allow the people who need help and put them on a plan that allows people to buy across state lines, have choice, have some subsidies when they need it, and that would be like the Federal Employees Health Benefit Program, which is what the people in Congress have. They have an array of choices, over 100 choices, and if they don't like the service they're getting from an insurance company, they can get another one at the next enrollment period. That's called competition. That's called the free enterprise system.
I like it. Doctor, thank you so much for your time. We sure appreciate it. Dr. Donald Palmisano joining us here this morning.
You can go to protectpatientsrights.org and learn more about it. Thanks a lot.